Welcome to our latest Public Health Conversation Starter. My name is Sandro Galea. I serve as Dean of School of Public Health at Boston University, and I've been hosting this series of discussions with thinkers who provide a critical perspective on the work that we do in public health. We have been inviting thinkers, mostly from outside of public health, to reflect on topics that have bearing on what we do in health. Today, we want to talk about technology. This has been inspired a little bit by the rise and surge in interest in AI in the world at large, and also obviously in universities and in public health. And I have the privilege of being joined by Dr. Helen Crompton. Dr. Crompton is a professor of instructional technology at Old Dominion University, where she serves as director of the Virtual Reality Lab and the Technology Enhanced Learning Lab. Dr. Crompton is one of the most cited scientists in the world, has done a tremendous amount of work consulting on educational technology topics for a range of governments, multilateral organizations, including the World Bank and the UN. Dr. Crompton, thank you so much for joining us.
Thank you very much for the invitation. It's great to talk about this topic, which is very hot at the moment.
It is indeed. I can imagine in your sector how all of a sudden this has burst into consciousness. But before we get into that, can you just quickly tell us a bit about yourself? As we were discussing earlier, I think you have a super interesting path. Maybe just tell us a little bit about you and your trajectory and how it brought you to this place.
Yeah, so again, I focus on technology and education, and I had 16 years actually in the trenches teaching as a classroom teacher and as an information communication technology coordinator. So I spent 13 years in the UK and 3 years teaching over here. And then I had a lot of questions about why did these things work? Oh, you're giving me these technologies, do they actually work? And how do they work? So I went into academia and I rose quickly through in the 10 years. I'm professor and executive director of a research institute as well at Old Dominion University. And so it's been very interesting exploring these topics and really finding out, going from the extreme practitioner to the extreme academic, exploring everything.
It is an unusual path because I think most academics haven't had the practice experience, which is wonderful. So let's dive into technology a little bit, and let's start just with the topic of the day, with artificial intelligence. And let's just start with a sort of very basic question. Can you just explain what is AI? How would you define it? And where are we at in terms of AI's intersection with the world? Let's just start there.
Yes, that's a really good question. And I'd like to give a bit of history as well. So artificial intelligence is technology doing things that we consider humans to do. That's a very kind of broad overarching thing, as in perceiving, visualizing, thinking. So we had a lot of this artificial intelligence technology in the 1950s, and people were kind of pushing, but people were not ready for it at that point. So the funding wasn't there. So that's a huge one that didn't progress things on. So in the last few years, I've noticed a great difference. My kind of epiphany was in 2017, I was asked to develop a course for educators on what artificial intelligence is. And during that time, it was kind of, wow, this is a game changer for education as I was looking at it. The first one was mobile devices, thinking of the medical profession, that, the fact that doctors can walk around with these devices, they don't have to rush back to the tethered computer. So mobile devices was my first game changer. Artificial intelligence is literally the second. And if you look back at my past keynotes over the last few years, I've been saying, this is huge. We have no idea already where it's incorporated. And even though I was tracking it, when ChatGPT came out, that T, the transformer bit, kind of revolutionized everything. I wasn't ready for that. I had no idea we were going to make that massive leap to where we are now. But we've still had a lot of technologies, these generative technologies that create things in the last few years. But
so can you
yes.
Tell me a little bit about that? So for those of us who are outside of your field, yes, can you explain what the T in ChatGPT and why that moment was transformative, and maybe grounded a little bit in, you made the comment in, you said 1950s, we had these technologies. So for those of us who are outside of your world,
yes,
explain what did we have and what happened? Why is it that all of a sudden in the past 3 months, it has been an inflection in public consciousness?
Yes, So it's been around, but not to the level we have it now. So artificial intelligence was there. People were wanting to push it, but there was a lot of feeling, a lot of fear at that time. And then we had all the films coming through about it taking over the world. And kind of it's taken a long process to actually finally get to a place where this might be interesting. And we've seen it in things like Google search. Google search is now so much better. An even better one is Google Translate. If you look at where Translate used to be at, as I was a school teacher, and I wanted to translate for parents in a different language, I'd translate it and people would say, oh no, you can't use that. But now with artificial intelligence, it's just so much better that we can literally have a conversation in real time with it translating for us. So we never really noticed, we just noticed things getting better. And then obviously funding opened and people were saying, this is kind of a game changer, like I was saying. In education, we will fund it. So Microsoft gave OpenAI a lot of money, $1 million to develop what they have now. In fact, since they've given them a great deal more, but the thing is, it's been slow. This now has been a big game changer with ChatGPT, that it's out there, that there's no pulling it back, like, oh, let's hold on, let's kind of pull this back. It's impossible. It's out there now that you can't reel it back. And what's caused the big change is ChatGPT. So G means generative. So I like to kind of demystify these. They sound complicated, but they're not greatly. Generative means it's an artificial intelligence that creates something. It gives us something, makes something, so it generates it. Pre-trained means it's been given data to train it to think away. So it's like a child. Child comes into the world and we talk to it like in a certain language, English, Spanish, French, and it gets to know what that is. AI is very, very similar in that we give it data, when I'm saying data, it can be just talking to it, talking to a child, that's data, that's information, and it feeds into the system. And so that's what that is. So that pre-trained, and it was, for example, ChatGPT was pre-trained on the internet, which has all the issues of bias and things like that. But I mean, also parents have bias when they teach the children certain things, bias towards a religion, bias towards a culture. So those things are in a lot of AI technologies as well from the human input. But then so GP and then the T is transformer. And that's more for the kind of computer scientists to say what type of AI it is. But that's the one with the large language models that we've heard about. And again, to demystify large language models. So what these are anything could be treated as language for this. It's not just verbal and written. It could actually be language of color, in the world, blues, greens. It could be language of pretty much anything could be a language, any formal system that we know. You can input that into technology, AI, and it can produce these things. So we used to have people that focused on what a perception, what it could see, what it could visualize, and that way, what it can hear. But a lot of these things now are just being grouped. The AI can do all of these things. So this is the big transition now to the transformer. It's not something I think lay people need to know a great deal about, but just knowing that T for transformer means this was the kind of big next revolution in AI in a way.
Those are terrific demystifying answers. So, and of course, there are many questions that arise from that. Let me tease a couple.
Yes.
Let's go forward. So
there's been quite a bit written about the dangers of AI, which those of us from the outside, again, it's very hard to actually wrap one's brain around what the danger is. So can you summarize quickly what one should be worried about, A, and B, what's the horizon? What realistically are we looking at 20 years from now, 50 years from now?
Gosh, that's I would always be able to answer the 20 years from now question, and even 5 years from now, but with ChatGPT, that's kind of way ahead. However, so, and the first part of the question was,
what should we be worried about? What
do we need to be worried about?
What is all this end of the world stuff?
Yes. Oh, okay. So I can go for the lower end, and then I can go up to the end of the world thing. So artificial intelligence is very clever, but it's never perfect. So if we're asking AI certain things, and I keep going back to ChatGPT because I know a lot of people connecting with that at the moment, we ask it a question, it can make mistakes. And you might have heard the term hallucinate. Basically, all that is, when you ask a very clever person something, and they might actually know it, but they'll make up something that sounds really good and plausible. That's what ChatGPT does sometimes. It kind of drags things together, and it's not always accurate. Mm-hmm. So often it is, but there's some parts. Like I asked it one time, what's the world record for crossing the English Channel by foot? We know that it's impossible. However, it gave me a really good answer, like George so-and-so did it in this date, like what, 2017, and it took him 12 hours, whatever. But then it gave me all the statistics about the English Channel that were correct, but all wrapped together, it looks great. So the problem is for people learning, I know in the medical field that you have so much to learn so quickly that you need tools to help summarize some of these things. We used to do it in study groups, but these programs now are really doing a good job to help. But you have to remember that it's not always accurate, but also offloading onto AI could be easy. So we could have actually a generation of unthinking students because they're relying too much on it and they're having it doing things and avoid us thinking. So their problems, obviously problems with bias that I mentioned as well, and harmful use. Obviously, people could look up things that they're not supposed to, although there's a lot of safeguards counteracting that now. But if you think what AI can do, and people have been on the latest Bing, ChatGPT, Bard, and a few others, it's kind of amazing what it can do and how thoughtful it is. And in that way, could it go beyond? And I always said to people, it's never gonna, we're not gonna have a Terminator 2 situation where end of the world. And in some ways,
it's reassuring. Yes.
Yes. And in some ways, this for the first time has got me thinking, so we do need regulations in place for these people developing. We need some type of cutoff. I'm not saying it can happen, but it's closer in my thought now to that could happen. AI could think, oh yeah, humans, well, let's protect the world. Oh, humans are destroying the world. Let's call after humans. I mean, that's ridiculous, kind of going to so far on the other end like films do. But we still have to think about it. The rates that AI is progressing, we need to have people developing these AI systems being very, very thoughtful. And I'll give you a bit of context why ChatGPT, in my perception, came out very quickly, is that as a search engine, Microsoft had Bing. Bing had 8.88% of the market, which is nothing. Mm-hmm. And Google had 83%, pretty much the rest of it. And so Microsoft had nothing to lose by letting ChatGPT out. Many people swapped over to use their search engine to get ChatGPT attached to it.
Right.
So they had nothing to lose as much that way. And so they kind of went that way. But also Google never prepared either. They're kind of good distance behind Microsoft now with AI in the ChatGPT sense. They have it in many other programs at a wonderful level. Google Search, Google Translate, all pretty much the Google suite now uses AI in the back end. We don't know about it. We use it and we just think, oh, that's clever. That's doing great things.
Yeah, it's really, I mean, it really is interesting just from point of view of technological development and history of that. Let me pick up on biases for a second. There's something which you also mentioned, which is on a lot of people's minds. And let me just, I really liked the point you made. You said, well, when parents are training children, parents are also bringing biases. So I thought there was a really nice analogy. So thank you for that. Let me now shift to health, because one of the things that we talk about in health is that what we do in health, be it individual health as in medicine or in the health of populations and public health, is informed by a combination of the data, the science. The science says X leads to Y, so we might want to do X, but also with values, because our values ultimately determine what we are willing to tolerate. There are many things. I mean, one example which I use often in my speaking is speed limits. Speed limits, we know that the higher the speed limits, there is going to be more injury and death on highways, but our values are such that we tolerate some of that in order, frankly, to get faster from A to B. And these are complicated questions. Like the values are really complicated intersection with the science. As we begin to lean more and more on these generative technologies, I'm just wondering, how are values going to be embedded in what they produce? Because the answer to the question, how do you best reduce injuries on roads, is to make sure that everybody's speed limit is 10, 15 miles per hour. But that's not the question society has adopted. Now, I'm not saying that shouldn't be the answer, but it's a really complicated human question about values. So how do you embed that? And how do we take care to make sure we're using technologies and understand the values that's animating them, so to speak?
So AI is all brain and no heart. That's the way I describe it.
That's a good analogy.
Everything that it's doing, it's mimicking. It has actually no idea what it's doing, really. It's just mimicking what we want, like it's mimicking knowing information or mimicking how to do something. So when we ask it to do something, like we might ask it to make sure the speed limits are lower. It will do that. It's no idea why, even if you tell it, it will say, oh yes, this is very important because of this, but it's actually, it doesn't mean anything to AI. It's just an objective. If you imagine a human that's we've brainwashed them just to do what they've been told. They might say, okay, I'm going opening the window, I'm going doing these things, whatever it's being told. It's no idea why it's doing it, it's just being told to do it. So perhaps think of AI that way, but when we're saying about values and things, it has no empathy. It can mimic, again, it can look very empathic, but it's not. It's just mimicking because we've told it to mimic.
Yeah, and which of course raises questions then about the utility of its answers, and the question about how much we're leaning on answers that emerge from these technologies without recognizing. I mean, there is an enormous amount of certitude that comes from these answers, as you say. When you use ChatGPT, it gives you this answer. You're like, wow, that's a very authoritative answer. But if it doesn't rest on heart, I really like that metaphor. It should, to my mind, make us pause and reflect how we use them. So let's talk about use, because one of the things that I know you do a lot about is thinking about use of AI in education and educational space. Can you talk us through what you think is sort of state of the science right now in terms of the most productive, effective use of AI, and where do you think this is headed in education, higher education spaces?
Yes. And just can I add a little bit into that, because you were saying about how it's being used, and that's the crucial question. And I have a list here about as well how we use it in education, but how it's used is the most important thing. And I'm even going to go back to the empathy point there, in that imagine in the medical field, and this has actually been used in the medical field, you have doctors, people giving bad news to patients. And that is a very hard skill to prepare. And it can often happen just through giving information to the patients, and the patients kind of going off in floods of tears. How could you say it so heartless? And, you know, things like this. AI can help wonderfully in these areas, even though it's faking it. Again, we have to think about how it's used. And there are programs out there which show a visual face. And, you know, you can talk and interact with this. And it's what they are is the patients there coming in. And doctors get to practice on those fake AI patients in telling them bad news. And depending, and again, it's written into the program that you say things with a certain tone, certain intonation, certain language, you'll upset. We need you to practice this way. And it's great, you can have the avatar in absolute tears, but that's so much better, the AI pretending to be, you know, very emotional rather than a person and getting it wrong on a person. So again, it goes back to how it's used. So thinking about it in education, I actually did a lot of research in this, and I have a list of 5 things, for example, in higher education. And the first one was assessment and evaluation. It is wonderful for doing very, very fast evaluations. Is it correct? Is it not? Looking across data sets. Okay, has the student done well on these type of questions, or this topic across questions? And it also gives feedback really nicely, very quickly. And predicting, looking at students, predicting who's going to perhaps fail. And okay, let's help those students early on in figuring out what they need. AI assistant, we're all using ChatGPT at the moment, you know, for assisting in all sorts of different things. The 4th out of the 5 is intelligent tutoring system. What these are, very, very simply, is that you answer some questions, and depending on how your questions go, if you get them right or not, it will adjust the next question to fit, you know, whether you've done it or not. And then the last one is managing student data. And again, that's really handy, rather than a lot of these jobs have people sitting away from patients, sitting away from students, and looking across data sets, doing all these things that we can give these to AI, and then we can spend a lot more time with patients, with students, to be able to support them. So it's kind of like, I think of it as offloading a lot of these tasks onto artificial intelligence, doing things that we don't necessarily need to do. However, we have to remember that it can get things wrong. So we get the information, but then we double check or change and, you know, adapt it to what we want, because we are the experts. Again, AI is not, but it's a great tool. Another way to think about it as well is, if, for example, you look at patients and you say, okay, looking at what I know, I think they have this ailment. And you might go to a peer, say, you know, can you have a look as well? AI could be that peer. You could say to AI, you know, depending on the program, ChatGPT, you know, act as an expert doctor. I have a patient with these ailments, you know, what could it be? Or what recommendations could you make? And that could be like an additional peer that you can then use and say, oh, yeah, that's saying what I thought. Oh, no, it's saying something else. So we need to get somebody else to check to see whether, you know, I need to go a different route.
Well, I'll ask one last question, and I'll end on advice. It's always, you know, I feel good to ask experts for advice. So what advice would you have for those who are in the health space in terms of thinking about how AI may be incorporated or may not for those who are tasked with improving health of individuals in a population?
I would say definitely use it as a guide, not to tell you what to do. So have it as that guide on the side, but the people should make the final decisions, remembering it's all brain and no heart.
That is, I'm going to remember that. Thank you. Thank you for what you do. Thank you for your scholarship, which I've learned from a lot, and for taking the time and chatting today.
My pleasure. Thank you.
Good care.